Hey Adrian, how are you? We're gonna do this special test that is called electroretinogram. And after that test, we're gonna take some images. And with that images, the idea is to see how his retina is working. I was exposed to ophthalmology at the end of my training in medicine. I thought I wanna be a pediatrician. I rotated 20 weeks in an elective in different areas in pediatric. When I discovered that this tiny world that is the eye is not a tiny world, it's a huge thing. It's a universe with a lot of different diseases, different conditions. And I was very attracted to learn how to help the people who has vision problem. You can really impact kids. It's amazing when you saw a kid who is receiving the right treatment. It's not just the vision, it's how they learn, how they interact, it's connection. At the end, it's building the relationships. When you do a change, it's a change that lasts forever. My name is Pablo Altschwager. I'm a pediatric ophthalmologist at Boston Children's Hospital. The two siblings, the ones who are preemies, he has a retinal detachment in this eye before, and this was after treatment. Okay. But the anatomy of this eye looks pretty good. I'm a pediatric ophthalmologist. I'm also the director of Pediatric Medical Retina. My role is to do the care of all the patients who has retinal condition, and also to evaluate all the kids who has dysfunction of the vision. I'm also the leader of the electrophysiology department. That is a specific testing that we can do to analyze how the visual system is working, how the retina is working. It's a very specific area, but the good thing is to bring my approach as a pediatric ophthalmologist to the retinal area. Hey, Aiden.
Look the car.
Good. Where's the car doing? When you work with kids, of course, you couldn't do the same as you do with an adult. The only way that a kid will cooperate with your eye examination is that you create some trust. Sometimes that comes with a conversation, sometimes that comes with some games, sometimes that came using a toy. In my case, I always use my phone because I have an app that I have used for many years, and the kids love that. And that's one way that they connect, they keep a memory of the visit, and the next time they want to do the same, and that helps a lot. ¿Qué número es?
8, 5, 35, 96.
Super bien. What motivates me to come to work every day is that every day is an opportunity to see someone who will benefit from my work. Sometimes, as I say, it's a smile. Sometimes it's a patient that see you. Sometimes is see this family, how they react when they are able to see that their kid can see. And of course, sometimes there are some more challenging days when you have a kid who are not able to see or has a very low vision, but being able to work with that family, being able to share with them your knowledge, your care, and trying to show them some hope is something unique.